Hello and welcome to How Does Acupuncture Work? Part 3. The plot thickens. So everyone wants to know what is the modus operandi. And of course, let's try and take a practical example here. Sciatica, a very common problem, very painful. And let's look at the sciatic nerve. Now, the sciatic nerve has light touch sensation nerve fibers, so you can feel sensation. It has hot and cold nerve fibers. It has proprioceptive fibers, which tell you whether your leg is straight or bent, for instance. It has pain fibers. It has motor neuron fibers for obviously working the muscles. And then there is the special A delta fiber, which is what the acupuncture needle specifically stimulates. Now, a person with sciatica will describe different symptoms. They may say there's a burning pain that's affecting the nerves which are relating to hot and cold. They may be a numbness, that is the fibers relating to light touch. There is a feeling of shakes or vibration or tremor, fasciculation, and these can be the motor neurons, can be the proprioceptive fibers, and of course we have to mention now the parasympathetic and sympathetic nervous system. In addition, those fibers govern things like sweating, for instance, and things like goosebumps when your hairs stand up. Those are all regulated by the sympathetic nervous system. Now, the thing about acupuncture is that by needling around the area, you try to restore normal function of those particular nerves which are involved. In 30% of people, the sciatic nerve actually runs through the muscles of the buttocks. So if there is any muscle spasm, then the muscles will clamp down on the nerve as it goes through, and this is a very common cause of sciatica. Now, people will often come with a CT scan of their spine and tell us, oh, it's a disc, it's a disc. Well, the odds are usually about 80 to 90% it's not a disc. The scans will show bones, they will show discs, but they do not show muscular tension. So we know that 80% of back pain is muscle and ligament pain, and this is not shown on any sorts of scans, and this is why we have to physically examine the patient. Now, time and time again, people present to our clinic with a stack of x-rays and films and reports and what have you, and oh, it's this and oh, it's that. And then you ask them the simple question, has anyone actually examined you? Has anyone actually put their hands on you? And, oh, no, doctor. Oh, the doctor just gave me a slip and off I went for a scan. Basically, if doctors would actually examine their patients physically, they would determine that a lot of the problem is simply soft tissue related. And the main point about doing acupuncture is that you cannot do acupuncture without actually examining the patient. So there you are. So when we do our acupuncture, not only are we doing the acupuncture, but we are doing a physical examination first, and then we get a working diagnosis, and then we determine where to actually put the pins. Not surprisingly, This puts us light years ahead of most GPs who just work from a simple report, which is often uh, wrong. And therefore, this leads to the incorrect diagnosis, followed by spinal injections and surgery and what have you. And all the time, it was a different problem elsewhere. Nobody bothered to look.